I'm here to talk about jaw pain. I'm sure a lot of you have been a bit under stress lately, as can be imagined. And a lot of us tend to grind our teeth more and tense and clench our jaw throughout the day. So when I first started having jaw problems, I was pregnant, and my symptoms included dizziness, headaches, migraines, neck pain, neck tightness, pain in my sinus area, pain in my cheeks, pain in my ear, ringing in my ear. So TMJ can have a whole host of symptoms that seem unrelated to jaw issues at all. In fact, for me, jaw pain was the last thing to show up, which is pretty interesting. I even ended up having an MRI, a brain MRI, just because the dizziness, they couldn't figure out what was causing it. In fact, I had gone to 5 ENTs, maybe 5 physical therapists, 3 chiropractors, 5 dentists. I even have 5 mouth guards from 5 different dentists, and only one of them worked really well, and I can talk about that later. So the types of TMJ, or temporomandibular joint problems, include myofascial, which is mostly a muscular issue. The muscles of the jaw are tight and they cause pain and other symptoms. The second type of TMJ problem is a disc issue. There's actually like a disc-like structure in there that hurts when you compress it too much. It can get inflamed, get irritated. So that's like a disc type of TMJ problem. Around the TMJ, or temporomandibular joint, there's a capsule. And if you open your mouth too wide and it hurts when you overstretch it, that is a capsule issue. And that usually happens when there's some type of trauma to the joint that overstretches the capsule. Last, and the least common really, is arthritis in the joint, or arthritis in the TMJ. That is the least common that I've found in my practice. The cause of jaw problems, one is stress, and right now everybody's under stress, like I mentioned. Totally natural, we can work with it. The thing is, most of the time we clench our jaws and tense our jaws when we are asleep. Most of the time, that's when the worst of the grinding and the clenching or bruxing happens. So at night, our brains try to do housekeeping. It tries to process what we do throughout the day, and that's when all that tension goes out. We just chomp away at night, chomp, bite, clench, grind. And that's when you wake up in the morning and you realize your jaw is tense and you have headaches. So all of my patients, when they have headaches when they wake up, usually it's because they were clenching their jaw all night. So if you go to bed without a headache, but you wake up with one, it's either your pillow or you've been clenching all night, or could be both. Now, one thing too that could irritate the jaw is if you bite down on objects that you're not supposed to bite down on, like ice, chewing gum a lot, biting on pencils, things like that, biting on things that you're not supposed to chew on too much. In my clinic, I find that's the trickiest one to treat, is when people have actual trauma to the joint. One more thing that can cause pain in the jaw is rheumatoid arthritis. Now, people with rheumatoid arthritis, usually they are told by their rheumatologist that you can have pain in your small joints of your body, but the jaw joint is also susceptible to flare-ups from rheumatoid arthritis. Last but not least, one of the things that people don't know about that cause jaw pain, that cause jaw clenching and grinding, are medication. Antidepressants such as SSRIs and tricyclics can increase your chances of bruxing or clenching or grinding your teeth. In fact, usually the higher the dose of the antidepressant or SSRI or tricyclic, the more you grind or clench your teeth. The thing with the treatment for jaw pain is there's really not one single treatment for it. There's not one magic bullet, but that's okay. That just means there's a lot of different things that you can do at home or with a health professional that can help your jaw pain. One of the first things you can do is get a good mouth guard, because a mouth guard won't stop you from clenching your teeth, but it will help protect your teeth, and it'll help cushion the joint from having too much compression in there, because it'll keep the teeth enough of a distance apart that it won't compress that disc. It won't compress your TMJ or your jaw joint as much as if you didn't have a mouth. What did work for me also was muscle relaxants. I know chiropractors can't recommend muscle relaxants, even though they are over the counter in Canada. Here in the United States, muscle relaxants need a prescription, so talk to your doctor, ask them if muscle relaxants are right for you, because most of the time they will make you groggy. Do not overstretch your jaw. In fact, if it hurts when you open your jaw too much, you can actually block how far wide your jaw opens by just keeping your hand under your chin and keeping it from going too far and irritating your jaw. Good sleep habits use a good pillow. Don't sleep on your stomach. Don't sleep with your hand on your jaw, moving your jaw in a funky direction all night. Lastly, a great exercise that everybody can do, not just for jaw pain, but for muscle tension and insomnia. Start at the top of your head and you work your way down. Imagine relaxing all these muscles here. Keep your eyes closed and you relax all the muscles at the top of your head and go down to your ears. You only proceed down as long as you feel the muscles relax. So when you're at your ears, make sure you relax that area, and only when you feel that that's relaxed do you proceed on to your jaw. Make sure that the jaw muscles are relaxed. If you're not sure how to relax your jaw or what position it's relaxed in, say the letter N, and that's a nice soft position for your jaw. Now proceed down to your neck, relax your neck. Take your time. Nice, easy breaths, steady breaths, down to your shoulders, and keep going down. Practice that every night, and it's a really good habit to do. It helps with muscle relaxation for your neck. It can help with migraines. You can even practice it during the day. And all these little habits, having a mouth guard, sleeping properly, not drinking stimulants at night, using your exercises, doing self-massage, self-care, we all could use that right now. And I hope that this talk helped you.